Hello everyone, in today's video we are going to learn about the SINSS model. So previously it was called as SIN model, then with time it is modified into SINSS model, right? The double S added later. So it was given by Maitland first, but interestingly it was used in Syriac's concept and also later in Mackenzie concept. So hello, my name is Shanglap Kundu and I am pursuing my NPT Neuro from NILT Kolkata. So in SIN factor or in SIN model, the first word is S, right? So S stands for severity, which is basically the intensity of the symptoms, including the subject's pain level. Now you can measure this pain level by NPRS, that is numerical pain rating scale, or VAS, that is visual analog scale. But you can also use other charts, questionnaires, and so on to determine the subject's pain level. The second is I, which stands for irritability. That is the level of activity required to aggravate the symptoms. So we know there are two factors, right? The aggravating factor and the relieving factor. So the amount of activity that increases the symptoms is the aggravating factor. And irritability can be determined by the ratio of aggravating factor and the relieving factor. Now the third word is N, that is nature or the nature of pain. A simple example could be, so if you see patient comes to you with a dull, aching, cramping pain, it may be suggestive of muscle pathology. But if the patient is not complaining the cramping part, or patient has only dull aching pain, then it may also be suggestive of ligament or joint capsule pathology. Now these are the things that the patient is saying, but you have to determine that symptoms with your clinical knowledge. And here comes the barrier concept of Maitland. So remember this, when you are checking a patient, whatever the patient is complaining, you should or you need to correlate with the theoretical concept that you have in your total 4 year of bachelor's or the next 2 years of your master's. So it is very important to diagnose the condition properly. So the last two words of the SINSS model is the double S. Now the first S stands for the stage of the inflammatory process or healing. Now the stage includes acute stage, subacute stage, and the chronic stage. Acute means the early stage, subacute means the middle, and chronic means the later. So if we say the timeline, roughly acute stage stands for 1 to 2 weeks after the incident or after the trauma. Subacute stage stands for 2 to 6 weeks or maybe 2 weeks to 2 months. And chronic stage sets in after the subacute stage, which is roughly around 3 months after the traumatic event, or in some cases after 6 months, right? But all of this depends on the condition that the patient is having. Now the last is of this SINSS model is the stability of the patient's symptoms, right? And it is very essential to evaluate the effectiveness of the assessment, and the treatment is provided by the therapist. So very easy example to understand this is peripheralization and centralization concept. Now suppose a patient comes to you with low back pain, and the patient is saying that I have back pain and the pain is radiating to my left lower extremity. Now you are treating the patient, and after 1 week when you are reassessing the patient is saying that okay, I have back pain, but now it is not radiating and I'm feeling much better. So that means the pain has centralized. And this is the centralization concept given by the Mackenzie. And this is a green sign or a green flag, and that means you need to continue with your treatment that you are giving to the patient. Now suppose a patient comes to you with just low back pain, but you are treating the patient for 1 week and the patient is saying after your reassessment that I have pain and it is increased and now it is radiating to my left lower extremity. Now that means the pain has peripheralized, which is a red sign, and you need to immediately stop the treatment and you need to rethink of your assessment and the treatment process that you are giving to the patient. Right? So I think I have made this concept clear to you, and this is very easy, the SINSS model, and you need to mention that when you are assessing or say reassessing the patient, right? I hope I have cleared the concept of this SINSS model, and if you have any question, then please don't forget to mention that in the comment box and I will definitely get back to you as early as possible. Please consider subscribing to this channel. Thank you so much.